to this really important meeting. We're really pleased that there's so many people here. As you probably know, there's an overflow room both further back. There's an auditorium in the further out in the Lewisham Hospital and also in the Calabash. So we've got so many people coming. We're really grateful that people are here. Thank you so much. I'm Brian Fisher. I'm a Lewisham GP for the last 150 years. I both worked with the Clinical Commissioning Group and the PCT before that and the PCG before that, so there have been so many reorganisations. This is one of a large number. So I will insist that our speakers are very brief, because I really want to make it possible for people to speak from the floor as much as they can. And I'm sure that people will be passionate and angry in this meeting, but I do expect everybody to be mutually respectful and to give people time to speak and to respond. And it's slightly complicated because speakers will start here and then halfway through they will decant and go to the Calabash, and Calabash speakers will come here. So there's going to be a break in the middle where speakers move around, but there'll still be time for us to continue talking during that time. Can people hear me at the back? Yeah, all right so far? Housekeeping, there are fire exits there and at the sides, toilets outside. There's no fire alarm planned so far as I know. We're collecting contact details, so I think there are forms going around. Please fill them in. We're very, very keen to keep in touch, and there's going to be so much activity over the next few weeks and months that we really want people to be as involved as possible. This meeting has a Lewisham focus, but it doesn't exclude us discussing and having solidarity with other campaigns, and indeed we've got a speaker from another campaign here today. So this is part of a South London set of campaigns, and we support each other, and that's really important. Although we're focused here on Lewisham, we're part of a wider set of activities. So I've seen lots of changes in the NHS over my working time, and the NHS has always innovated and it's always been able to change. But change has to be for the better. It has to be better for the patient and better for organisations. And it's not at all clear that these changes are better for either patients or the organisations. It's also not entirely clear whether the administrator has the legal right to include those in his considerations at all. If we start from the position of a market in health, then the financial bottom line dominates thinking, and this is where the government and the administrator has begun. And it is undeniable that there is a huge and expanding financial hole in South East London that can't be escaped. So I want to very briefly just outline what the changes are so that we all know roughly where we're at before we take things any further. So I'll very briefly summarise those and then I'll hand over to the speakers. So what the administrator is suggesting is, so far as urgent care is concerned, that Lewisham will continue to provide urgent care for those that don't need to be admitted to hospital. A 24/7 urgent care service that will treat around 80% of the people who currently attend A&E and the urgent care centre now. So that would still mean that people with minor fractures, wounds, abscesses, x-rays and so on can still be dealt with at the urgent care centre. So far as maternity is concerned, in the report, the administrator says that they haven't come to a decision about exactly what would happen to maternity. There are 5,000 births per year in Lewisham. If that were to shut, it's entirely unclear where those women would go. It seems to me that maternity has to stay in Lewisham under all circumstances, and that is an absolutely red line. It would need to have a high dependency unit and obstetric anaesthetists, and all of those would have to stay at the very, very least in the hospital. So, the other suggestion is that there would be planned operations. Lewisham would become a centre for planned operations and non-complex surgical intervention procedures such as hip and knee replacement, and that would serve the whole population of South East London. There's a proposition to merge with Queen Elizabeth Woolwich, so the Queen Elizabeth Hospital site would come together with Lewisham to create a new organisation focused on the provision of care for communities of Greenwich and Lewisham. That the private finance initiative debt, so this is the mortgage that the South London Healthcare Trust has accumulated as part of the PFI, would be wiped out, and that would cost the government £207 million. There's a community-based strategy, so that which is planned for the whole of South East London, that would support community services, and they are recommending that that be implemented. And it's unclear to me what would happen about children's services in Lewisham. It's hardly mentioned in the report, and there is a suggestion in the report that the administrator would want paediatric services to go to Woolwich. But it's very unclear from there, and that would be an absolute disaster so far as Lewisham is concerned. And there is a plan also to sell off 40% of the Lewisham site. So all of those are, that's what we are discussing here today. Those are the proposals, and they're part of a far more complex set of proposals that also involve the other hospitals in the southeast sector. But that's what we're discussing so far as Lewisham is concerned. So, I hope that gallop at least takes us, so people at least we're starting on the same place about what the proposals are. I'd like to hand over please to Heidi, who's a Labour MP